when do you tell someone that maybe they should seek surgery or a consultation for surgery? Because, there are patients who are, older and they just, everything's kind of sagging. But like, do you have that conversation with most of those patients, or you just kind of wait for them to tell you that, they actually are interested in surgery? Kind of how do you tackle that? Because, my perspective is different because of like what I do. But I am always curious to see how other people sort of handle that side of it.
Yeah, I mean, and I'm definitely interested in hearing your perspective as someone who does surgery. I would say there's a couple of things. So if someone comes in and they say, I want to look like this, or something, I'm pretty straightforward and I say, I can't do that for you. If you're, pulling, if you're pulling your skin and this is what you want to look like, I'm just like, there's no way I can give you that result. So expectation building is really important. So I will say, listen, we can help you, make subtle and small changes over time to, in a year from now, get you to a better place if you're willing to do that,
Right.
and take that journey with me. But, I can't do something one and done, like very quick. There's other times where I will tell people that they may want to speak with a surgeon. So eyelid drooping is one that I find is a common question. So they'll say, can you do Botox or fillers? Because my eyelids are heavy. Is there a way to lift that? And I tell people, like, we can maybe adjust the lateral brow, like a millimeter or 2 millimeters with toxin and some, well placed. But if you are, finding that you are compensating for heavy brow by lifting your eyebrows, and you may want to just consider going and having, at least talking to a surgeon, because the problem is your heavy lids are causing you to keep your eyebrows up. Keeping your eyebrows up means you get lines. Then you want Botox for the lines, and then you're in a cycle. And I actually just had this conversation this week with someone. I can't fix the heavy lid. There's no amount of Botox or fillers that I can put into like lift one eyebrow off enough that your eyelid doesn't touch your lashes. I can't do that. So that's another area that I'm a strong proponent of. See a surgeon. As far as I know, it's an outpatient surgery. It's, they can, depending on maybe how severe, but it's something that, some of my patients have done and they're very, very happy. And then the other times that I will suggest a surgeon or surgery would be for someone who wants with upper lip issues, I guess. So long philtrum, long upper lip, who comes in for lip fillers or wants a lip flip, with toxin, and they're just not getting the result they want. And I will have a frank conversation, like, you have thin lips, there's tissue there, but it's just not coming up. The way to really get a protrusion of your lip is probably surgery. Is that what you'd want to hear from your referring doctor?
Yeah, I mean, I guess my perspective on aesthetic medicine is that there's like all the different options that exist out there sort of in the world, and the list of possibilities, especially of like different modalities. And there's pretty much, I don't think there's anyone out there who offers all of them. I mean, it's rare to find someone who's truly offering, especially for the face, the full range of everything from skin care to facelifts and doing it really well. I think that's like, just doesn't really happen. So I just try to tell people, like, based on what I know about, other sort of specialists and modalities and what else is out there, I just tell them like what I think they really would benefit from, and some of those things I might have, some of those things I might not have, some of those skills I might not have, and then I let them kind of decide. And and if it falls in line with my skill set and they're there and they want me to help them, great. If there's like a machine such as like FaceTite, for example, that I don't have, but if they have some droopiness to their neck but they don't really want surgery, I tell them about this thing that exists that might be able to help them. I don't have the machine, so I'm just going to send them there. But I think, I don't know, my perspective is that it's important to kind of know what exists out in the world, and it's okay to let a patient go if you can't provide them that service that maybe is best fit for them. So I guess that's kind of how I approach things. But then like when a patient comes to me with an aging face complaint, I feel like they've kind of decided before they step foot into the office if they want surgery or they don't want surgery, at least at that time in their life. And I'm not the kind of, maybe I'm not a great salesman, but it's hard for me to, like, if they want injectables and they've got severe, jowling, and the neck's really lax, and I'll tell them, I don't think injectables are the right thing for you. I think you need surgery. Unless they're like mentally and just kind of prepared for that, they'll never be like, oh, well, I was gonna get, just some filler, but now that you said that, it makes sense. Like, let's do the surgery. So it's just, it takes time. Maybe they'll come back in 5 years and want to have that conversation. But I feel like a lot of people, they ruminate about the stuff, at home, talking to friends, and they kind of already have made up their mind which direction they want to go. And even if I give them my honest opinion, it rarely sways them necessarily one way or the other. Even with, like, severe, like, hooding and, and extra skin in the eyelids, like, you think it'd be so obvious, like, look at this, you have this extra skin, I have the skills, I can do this for you, can make it happen. They're like, no, I just want a little Botox. Okay. Like, so I feel like it's hard to change that kind of course unless maybe you're just, great at selling something. But I think it starts with just educating people. But most of them initially, I find that when they come to me, they have something specific in mind. Like, let's talk about this surgery, or let's talk about injectables for this area. But I still, I'll still be honest with them if I really don't think it's going to help them. And then if it's safe to do, I might still do it, but I'll kind of try to talk them out of it first. I run into this a lot with thread lifting. People will ask me, oh, like, can we do some threads? And I'll tell them all the bad things about threads. And I'll be like, well, if you still want it, we can do it. But you have to understand, the downside. But then again, I'm that way with surgery too. Even if someone doesn't ask me about, well, what are the downsides or the complication risks and all that, I'll make sure to share that with them, because people need to know risks of filler, risks of, lip lifts, facelifts. So I just like for people to be informed, and then they decide what works for them.
I totally agree. I do think I agree with you that people come in with a preconceived idea of what they want because their friend or someone they know had something. And I think in general, most people have already thought about the options, surgery or not. And I think, a lot of them just don't want to be put to sleep. They don't want that risk. So that's why they're coming in, asking about injectables. And I think just making sure that they are truly understanding the goals and what fillers or, neurotoxin can do, and that it can't give you the thing, that you're, the full thing, like all this, but it can help. And so I always say, like, look, we can try, let's do some, some toxin in the platysma. It's going to help a little with some of the lines, but it's not the same as, what you might be really wanting, but maybe that's enough for you. And you tell me, you let me know. And it's gone both ways. Like, some people are like, wow, I can't believe it's so amazing. I'm so happy. Just that little bit, those little pokes helped. And some people will say, you know what, I didn't really see a difference in that. So we're not going to do that. And that's okay. And I'm going to accept, whatever area is how it is until I'm ready to do more, let's say. So yeah, I think they already know. And I think that as long as you're clear, like, with your patients, like, I can't give you the result, that full result, but I can help you. I can help you, guide you to a better place, like in a year from now, if you stick with it.
Perfect. Yeah. No, exactly. Yeah. I mean, I think honesty goes a long way. I've seen it done, and especially in New York City, where people are promised quite a bit, and then that's not what they get, and they get very upset. So I get patients from certain other places, med spas, some other docs, and it's not like like the doctor or whomever performed like a really bad job. It's just that they didn't really tell the patient what they should can expect and what problems could occur. I think if you tell people that and they still decide to do it, well, then there's like shared responsibility.
Right.
So,
in a way, undersell. I always say you're going to be underwhelmed.
Yeah.
I don't want to look fake. Like, I promise, look, with 1 or 2 cc's of filler, you're not going to look fake. Like, you're going to look well rested, and you're probably going to want more, actually. So we're just going to stick with 1 or 2 to start. kind of thing.
Yeah, yeah. No, I like that approach a lot.